Finally, in hemolytic anemia, let's consider those disorders which are acquired. They're not inherited, they've developed in life. And I think the major one I want to focus on is the autoimmune hemolytic anemias, where the body makes antibodies against the red cells. Two types of antibodies are made. IgG antibodies, which you will know are quite high affinity antibodies. They bind at 37 degrees, and they're sometimes known as warm antibodies. Look at the top two pictures on the right there. On the left, you will see something we saw, similar to you saw a few slides ago, spherocytes. That's a characteristic feature of autoimmune hemolytic anemia. And you'll notice more reticulocytes as well, slightly bluish cells. On the right, you will see a stain for reticulocytes, and that's because the body is responding due to the hemolytic anemia. The second type of antibody that can be produced is IgM. These are less strongly binding. They often need lower temperatures to act, sometimes known as cold antibodies. But they're very powerful at agglutinating red cells. Look at the slide at the bottom of the picture. You see those clumps of red cells? They've been agglutinated by these IgM antibodies. These are sometimes found in older people who have plasma cells in the bone marrow producing these IgM antibodies, and it can be triggered by infection as well. We've spent a lot of time talking about anemia, but I just want to finish off by introducing the other side of the coin where a patient has too many red cells, and that we call polycythemia. Here we see an increase in the hemoglobin concentration. It makes the blood more difficult to pump around the body. It's more viscous. And complications here include blood clots, tiredness, lethargy, and also pruritus or itching, which is particularly seen in polycythemia vera. So I'll explain in a minute. On the right is a nice diagram to explain how to diagnose polycythemia and one of the common problems that we encounter. On the left, we see normal constituents of blood. In red is the red cell mass, and in green is the plasma volume. And of course here we're looking at the hemoglobin concentration, and it depends on the relative amount of those two. But on the left is the normal range. In the middle is somebody with primary polycythemia. Their red cell mass has definitely increased, as you can see, above the normal range. Their plasma volume remains the same. But on the right is a condition where the red cell mass has increased, but it actually remains below the normal range. But here we have a reduction in the plasma volume. So actually we think there's polycythemia because the ratio is now abnormal, although there is not actually a true increase in the red cell mass. So if somebody's terribly dehydrated, you may see that sort of picture. Let's look at how we classify polycythemia. Polycythemia, as you'll see on the left, can be classified as either a primary polycythemia due to a myeloproliferative disorder or secondary to an increase in erythropoietin, lung disease, smoking, altitude, or sometimes a tumour that's producing lots of erythropoietin and driving the bone marrow. And on the right is quite a useful algorithm for approaching patients who have potential polycythemia. You can see at the top the potential hematocrit that might make you consider that a patient has polycythemia, a male over 0.52 or a female over 0.48. Going down, you could check whether the red cell mass is truly raised, or if not, it's an apparent polycythemia. If the red cell mass is raised, are there causes of secondary polycythemia present? If that's true, it could be a secondary polycythemia. And if not, consider polycythemia vera. Now, management of polycythemia vera depends on the genetic abnormality of this disorder, which we now understand. Almost every patient has a mutation in the JAK2 gene, and we can use this to introduce new treatments. As well as taking off blood or using drugs such as hydroxycarbamide, JAK2 inhibitors, which are oral tablets, are now being used in this disorder. And I'll talk more about that in the lecture on myeloproliferative diseases. Secondary polycythemia is best treated by correcting the underlying cause, stopping a patient smoking, trying to treat the lung disease. But you can use phlebotomy, taking off blood donations if you need to. So in summary, I hope you've seen from these slides that disorders of the red cell are very common within the world. The management of anemia is dependent on making an accurate diagnosis of the etiology based on targeted treatment. But an excess of red cells can also be dangerous, and it's just important that we get the diagnosis right in those cases. Thank you very much for watching the lecture.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.